the question is asking you that what is known as misdirection of eyelashes. Options is given to you. First, A is the districhiasis. Option B is the trichiasis. Option C is the Meduhub, and option D is your poliosis. Very well, guys. Of course, this misdirection of eyelashes is known as your, of course, it is known as your trichiasis. But we don't have to know only the option which I am asked you. You have to remember all the options of this list, because maybe they can ask you anything from this, all of these options, right? So let's move forward in the next slide, and we're going to talk about the explanation of this particular slide. And you can see in this image, I included all the four options. What I did, I included your all the four options, and I'm going to explain you one by one all the images. The first one, which is your trichiasis, write it down. This is your misdirection of eyelashes. Yes, which is the misdirection of eyelashes, the first one. The second one, which is the districhiasis. So you can see, sir, what is the mean of misdirection? So you can see always what is the our eyelashes root, it will be going to come upward and coming outward. Yes, you can see it will also come upward and outward like that. But now you can see it is going inside. Some are going left, some are going right. Yes, it is not following the physiological directions. So this is known as the misdirection of the eyelashes. The next we are having the districhiasis. What is the mean of this? Of course, double layer of eyelashes. Yes, so what we are having here, we are having the double layer of your eyelashes, which is, you can see the districhiasis. Can you see here? You can see this is the one layer, which is the first, and the behind also you can see there is a one more layer is seen. So this is your double layer of your eyelashes, which is seen in the districhiasis. Guys, what do you mean by the Meduhub? What is the mean by the Meduhub? There is a absence of eyelashes, or you can write it down, no eyelashes. Yes, we know about it, the no eyelashes. Yes, there will be the no eyelashes. Can you see here is on the lower lid? Can you see there is a no eyelashes? Yes, you can see here there is a no eyelashes on the lower eyelid. There is on the lower eyelid, there is a no eyelashes seen on the Meduhub. Yes, on the Meduhub. Now the next, which is the poliosis. Yes, absence of the eyelashes is in the Meduhub. What is the mean of poliosis, guys? Please remember, poliosis can be seen in the any part of the body where we have the hair, or maybe in your scalp. You can see maybe on your beard, maybe on the face, maybe on your eyelashes. So there is a white patches of hair. Yes, there's a white patches of the hair will be going to seen in your poliosis, on the image of poliosis. So can you see here? You can see there is some white eyelashes. You can see here there's some white eyelashes patches is seen to you. This is known as your poliosis. Of course, the poliosis can be on the scalp also, maybe on the face, like on the beard also can be possible. The on the beard also can be possible. But if it is in the on the eyelashes, so it is known as your poliosis, right? In the scene is the poliosis on the eye. Is it clear to you? So there is an explanation regarding this eyelashes. We have this important disease only, the trichiasis. There is the misdirection of the eyelashes. There is the districhiasis, where we have the dual layer. Yes, double layer of the eyelashes. We have the Meduhub, where is the absence of the eyelashes. Yes, there is a no eyelashes will be going to present, absence of the eyelashes. And the last one, which is the poliosis, where there will be the, in the poliosis there will be the seen the white patches. Yes, white patches of the hair will be seen here. All right, so this is about your eyelashes disease and the eyelashes.